Hello, I'm Dr. Richard Downs. I'm a co-founder of Oracare Products Company, the maker of Oracare mouth rinse. And I've been asked to speak about the effects of Oracare on the oral microbiome and specifically how it might affect the nitric oxide levels in our bodies. So let me bring up a few slides. Okay, let's discuss it. This is nitric oxide in mouth rinses. It's a literature analysis summary by myself, Richard Downs. A little bit about me. I'm the co-founder of Oracare Products, oracareproducts.com. I'm a founder of USA Guard, which is a new nasal rinse company that is just coming out. I'm founder of Sleep Balance Academy. That is a company that educates dentists, chiropractors, nurse practitioners, physicians, and other healthcare providers in sleep medicine. It has a CE component attached to it. I'm founder of the Dr. Sleep Show, which is a consumer-based program, a television program on the new TV station called Champions TV, the Champions TV. I'm founder of the Dental Chiropractic Sleep Apnea Collaborative Facebook group, which also trains dentists and chiropractors to work together in finding sleep apnea patients that need care. Here's some of the talking points that we'll go over. I call this an address to the scorched earth evangelist. There are many people out there now on the bandwagon touting the evils of mouth rinses, any antimicrobial mouth rinse. And so this has recently been brought up to me to address. I have lectured extensively on the deeper subjects of the enterosalivary system, and I'll show you some of that information later if you're interested in getting more information from me. One, the human microbiome is an important concept, and that includes the oral microbiome. You are right to ask questions about this. This is something that we all, as scientists and health practitioners, should be addressing. It is an important part of our immune system, our health. Almost all the studies on mouth rinses, though, affecting the oral microbiome implicate chlorhexidine. Although approximately there are maybe more than 200 papers that discuss this subject, one of the authors I read distilled all these papers that usually cross-referenced each other, but only found 14 studies that actually researched the topic with science. This is a low number. It's not a high number, as some people have said. The Frontier study, which comes out of Houston, is one of the most referred to papers on the circuit, and people that are referring to it, including Dr. Oz on his TV program. In this particular study, though, there's a lot of problematic design criteria that I won't mention a lot of, but I'm just going to tell you a little bit about now. And looking at their parameters for people that they selected for subjects for this study, which there were about 26, every single one of them was using a mouth rinse before the study. And they included cetylpyridinium chloride rinses. Some of them included Listerine type rinses, and others that they didn't even know what the actual rinse was. So all these people were using a mouth rinse before the study started, and they were instructed to stop using that mouth rinse and begin to use chlorhexidine in this study. That seems to indicate to me that the other mouth rinses that they were using were not affecting the nitric oxide. And I'm making an inference here, but I would want to study, if I were going to do the study, I would want a study in which people were not using a mouth rinse and then started using this one, chlorhexidine. But anyway, this paper was about tongue scraping and chlorhexidine. It was more about tongue scraping and chlorhexidine than it was about anything else. And even one of their conclusions was that the chlorhexidine lowered the blood pressure on people who didn't scrape their tongue, which is paradoxical, because if it's lowering the blood pressure and they don't know why, by the way, they didn't have a good reason why, other than the bacteria changes on the tongue were different than the ones who scraped their tongue. And by the way, of the people who scraped their tongue and used chlorhexidine, after about 8 to 10 hours, the bacteria balance in the mouth, the microbiome came back with more balance and better nitric oxide production than even before they did their cleaning with the tongue scraping and chlorhexidine. And most of these patients were cleaning their tongue with a cleaning technique even before they started this study. So it's a confounding study. And it talked more about tongue cleaning than it did about chlorhexidine. But nevertheless, the study is about chlorhexidine. And to be able to cross-reference that to all other mouth rinses is wrong. Okay. In other words, many of the patients that were studied in that study were already using another antimicrobial mouth rinse. And by the way, in this study, the people were instructed to rinse with chlorhexidine twice a day for a full 7 days, and then they were instructed to go off the rinse for another 7 days, in which they studied the effects on the blood pressure. And I believe the blood pressure rose approximately three points on the systolic scale, not the diastolic scale. By the way, this frontier study, as well as other studies, had confounding results. At least 2 studies exonerated another of those 14 studies. 2 of them exonerated Listerine and Vatimecum mouth rinses. In other words, 2 studies that I read that were actually cited in the frontier study were Listerine and Vatimecum, and they had no effect on blood pressure and no effect on nitric oxide. So right away, we know that all rinses cannot be categorized together. Okay. The rinses most often implicated were rinses with substantivity binding activity. In other words, chlorhexidine and cetylparadignium chloride do bind to epithelial cells and remain there in a process called substantivity. The other rinses that were studied, most of the ones that I saw, did not have substantivity and also showed no effect on nitric oxide. And also, as I said before, the frontier study and another study from England imply that mouth rinses can actually balance your oral microbiome, not make it worse. They actually balance it. Okay. So just the word about scorched earth evangelism. The people that have said that, why I call them that is because I've run across people who said, I don't believe in the scorched earth approach to oral health. Well, I don't either. Okay. And also they've said other things like, oh, well, I believe the oral microbiome needs to be balanced. Well, I do too. So I just want to get that straight. I think there's a misconception of what scorched earth means. I think it means sterilize the mouth. And I don't know that anybody ever does that. I've never seen it happen. Okay. The ninth point is all therapies have a risk to benefit ratio. So does soap. So does any other hygiene practice. I don't see people stopping their showering and shampooing their hair, which upsets the skin microbiome. You must in these things consider the risk to benefit ratio. And so another study from Australia stated that they had a 2.3 millimeter rise in systolic blood pressure. And again, that was with chlorhexidine. 2.3 millimeter rise in systolic blood pressure, no effect whatsoever on the diastolic blood pressure. Also, there were studies in which the bacteria in the mouth was completely eliminated for a short period of time that do actually convert nitrates to nitrites. And yet the nitrite levels in the bloodstream went up instead of down as a result of that. And that was confusing too. They did not have a reason to explain that other than that we store nitric oxide in our tissues in the form of nitrites that come to use when we need them, including states of hypoxia and other reasons where other nitric oxide sources in our body are depleted. Other parts of our body seem to compensate. That's what they said in that study. Okay, 10, microbiome statements are not considering viromes and fungal contributions. What I mean by that is microbiomes are not just made of bacteria. Everybody's talking about bacteria, and they're supplementing probiotics are all about bacteria. And the more, the better. You can get too much bacteria, even good bacteria, in your gut. Did you know that? You can get too much. It seems like people latch on to things, and then they become kind of obsessive about what they're going to do about it, and they begin to overcompensate. And one of those overcompensation is probiotics. You can take too many of those. But now they're not also considering the fact that the virome is just as important in our gut and the fungi as the bacteria are. And I don't see people supplementing with viruses. These phages that are viruses that infect the bacteria are actually the controllers of the bacteria. You might not know this, but bacteria are kind of subservient to the viruses. They are like school children in a classroom being instructed by the viruses. And so to not pay attention to the viruses in these studies and in these statements is really not being very comprehensive with your knowledge and experience in how to handle these microbiome questions. Phages control the bacteria, as I said. Phages also control DNA expression. These phages can not only get into the bacteria, but they get into our cells and they actually control the bacteria. Microbiome statements are not considering also the microbial toxin therapies. Most mouth rinses don't address anything about toxins, viruses, yeast, but they do talk about bacteria almost all the time. They're taking a non-balanced approach to biomes, whereas Oracare takes a balanced approach to all of these particular problems with dysbiosis. Microbiome statements are not considering fungal contributions, and that's another part of the biome that we don't talk about. By the way, fungal infections are probably the main cause of root caries, especially in older individuals. And people are not talking about the fact that rinses, some of them address that fungal microbiome better than others, including Oracare. Candida inside the cells is also moving from the exterior of the cells inside the cells. What do you do about viruses and fungi that have moved inside our human cells? How do you control those with a mouth rinse? Okay, scorched earth evangelism is popular right now, but should not be repeated without knowing the studies on this subject. Coordinated host pathogen transcription dynamics revealed using sorted subpopulations and single Candida albicans infected macrophages. I've just referred to how yeasts are important in these programs. In the mouth, Candida albicans is a very important yeast. The team found that the fungus Candida albicans transitions from extracellular to intracellular pathogen, and it was accompanied by a coordinated time-dependent shift in gene expression for both the host and the fungus. These gene expression changes led to a gradual decline in pro-inflammatory cytokine activation by the host immune system. These are complex, and these systems are all working together. So, addressing viruses and bacteria, or even just bacteria without addressing yeast, are problematic. So here's a little schematic of what viruses do and how they work together. We didn't know that, many people don't know that viruses work together in a biofilm just like bacteria. In other words, many different viruses form together and they actually work as a community to do their work, just like bacteria do. And so this is kind of a faded little diagram here, but on the upper left, you'll see a phage on the top of that bacteria. It's inserting its DNA into the bacteria, and then these CRISPR particles that are remnants from old phages that have embedded the cell. They're kind of like an immune system in the cell. They have little pieces of phage DNA in them that they were infected with prior to, and they use those to fight against the new infection of the phage. These called CRISPRs. These are also used in making our new CRISPR vaccines right now. CRISPR technology is very important in gene manipulation right now. So anyway, the first attack on that bacteria may not kill that bacteria, but it becomes weakened. And on the right there, you'll see an unsuccessful infection, but the bacteria itself is now weaker. It's now available for a new phage to take over and infect that bacteria. And once it does, it goes into the cell and it's successful in entering that bacterium. And then it replicates itself on the lower left there into new viral particles. So the first bacteria made the bacteria susceptible to the second phage, and the phage then got in the second phage to use that experience of the first phage to become infective. They work together. So this is a reference to that. The team found that phages, which infect bacteria, can suppress the bacteria immune system, the CRISPR system, during an initial wave of unsuccessful infection. However, although this first phage may fail to replicate, the immunocompromised bacteria often succumbs to the subsequent successful infections of other phages. This shows that viruses cooperate to accomplish their viral survival, just like bacteria biofilms. Are all rinses addressing viruses? No, they're not. Oracare does. And we'll talk a little bit more about that in a second. So let's talk about Oracare specific facts, okay? No rinse study on this subject can be applied to any other rinse. I want you to get the idea. All microbial mouth rinses cannot be blamed for causing a problem with nitric oxide and the commensal system in your mouth based upon the chlorhexidine studies, which are most of them out there, okay? 2, Oracare has no specific studies of its rinse on the effect of nitric oxide in the oral biome. So just so you know, we don't know specifically what Oracare has done, but we do know that it's not a substantivity type rinse. Also, it reduces the microbiome more evenly than other rinses do. Oracare is not an epithelial binding rinse. Oracare kills bacteria, fungi, inactivate viruses, while also inactivating the volatile organic toxins that impede wound healing and facilitate the microbe penetration into those cells. And there is evidence that it also moderates the inflammation of tissues as well. No other rinse can say that. A balanced biome reduction likely is preferable to a lopsided microbial reduction in balancing the oral microbiome. A 2.3 millimeter rise in systolic blood pressure risk factor must be balanced against the huge benefits of centuries of good hygiene knowledge. We should be informed, yes, but skeptical of the bad facts in science without repeating them in a reckless way. So I'm done with that. I do have a more detailed lecture on actually the enterosalivary system, the complexity of the mouth nitric oxide system, the nasal nitric oxide system, the intrinsic nitric oxide system. And so if you're interested in that, we'll have that available. I gave that lecture in 3 places, Dallas, New York, and Las Vegas just recently to the Air Institute group. And so this is being put together in a package and will be made available later in a more comprehensive way so you can understand it more deeply. If you want more information, you can contact me about this. It's rick.downs3430@gmail.com, and I'd be happy to direct you to more information. Thank you for listening.